Okay, so if you have read and understood, considering it history-taking station, kindly please begin.
Good morning. My name is Dr. Mohammed Shirbini, one of the surgical trainee today. May I confirm your name and age, please?
Yes, my name is Andrew, and I'm 43 years old.
Hello, Mr. Andrew. Nice to meet you. Today I've been asked to ask you some question regarding your condition. Are you okay with this?
Yes,
Okay. And what seems to be the problem today?
actually, doctor, I feel pain whenever I walk for long distance. Okay, or it's a
I'm
severe
really sorry
pain.
for this. This must be frustrating for you, I consume. Let me ask you, when did you first notice this pain?
Yeah, this pain it has been comes and goes for long time. But recently, over the past 2 months,
Mm-hmm.
I feel when I walk just from here to the bus stop,
Uh-huh.
most of,
It
both of my
increases.
yes, both of my legs just ache me and I
I
feel
see. And do you feel the same pain at anywhere else?
no.
Okay. And regarding the nature of the pain, is the pain is stabbing, cramping, or knife-like pain?
Yeah, it's just like a cramping pain, to be honest.
I see. Okay. And on a scale from 1 to 10, 10 being 10 is the worst pain, how could you describe the pain?
The pain is 7 out of 10.
I'm really sorry for this. And do you think that weather is affecting the pain, either cold or warm weather?
Yes. When it is cold, I feel myself I'm not okay, and
I
I
see.
always looking. Yeah.
Yes, I see. And is walking up a hill or upstairs affect this pain?
Yes, always walking up hills is
Mm-hmm.
a help for me.
Yes. And how far can you walk before stopping due to the pain?
It's up to 15 meters, 15, 40 meters to the bus
Uh,
stop here, the convenience here.
I'm really sorry for that. And have you have you noticed any breach in your skin recently?
No.
Okay. And do you feel any coldness or on your legs or feet?
Yes, sometimes, not always.
Okay. Have you had any recent trauma to your back?
No, no, doctor.
Do you find any weakness or numbness in your legs or feet?
No, not always.
Okay. Do you find any difficulty in controlling your stool or urine?
No,
Have you recently experienced any erectile dysfunction?
no, doctor.
Okay. You mentioned that both of your legs are agonizing you. Am I right?
Yes, yeah.
Could you please confirm or the exact site of the pain? Is it your calf muscles or buttocks or thigh?
Oh, my legs, yeah, on the calf,
Uh-huh.
the back of my
I
legs,
see.
yeah.
I'm really sorry for that. And have you seen your GP for anything else?
Yes, I've got hypertension for 15 years now, and I'm on treatment.
Uh-huh. So you take medication for your blood pressure problems. Am I right?
Yes, yeah,
Okay.
right.
Are you known to have diabetes?
No, I don't have any diabetes.
Okay. And have you underwent any surgical procedures?
No, doctor.
Okay. Do you smoke, Andrew?
Yes, I'm heavy smoker, I can say.
How many packs per day, approximately?
Maybe 30 cigarettes, 3 packs a day.
That's a huge amount. And do you drink alcohol?
Yes, I drink well, occasionally with my friends at the weekend.
Okay. Approximately how many units per week? week.
15, 20, it's accordingly.
Okay, and what do you think might be causing your symptoms, Mr. Andrew?
I'm not sure. Is it from the hypertension that I have, or is it from my smoking?
Actually, your blood pressure problem is a possibility, but we cannot make sure that they are the cause of your symptoms until doing some blood tests and investigation to give us more information and to confirm the diagnosis. And what are the most things you are concerned about today?
Is it something that dangerous to my life? Is it
I
my
really
life?
I totally understand you and appreciate you, but as I mentioned, it is too early to judge that. We have to wait and do some tests and give us more information about that. Okay?
Okay.
Okay. And what do you think or hoping from us to do for you today?
Give me something for this pain.
We will do this, sure. And this might be a bit personal, but let me ask you, what do you do for a living?
I'm a mechanic.
Okay. And with whom do you live?
I was my wife and a kid.
Okay, and you mentioned before that you find a difficulty with stairs, walking up a hill or upstairs affect or increases pain. Am I right?
Yes, yeah, walking up hills.
Do you know anyone in your family members have a similar problem?
Yes, my dad has the same problems, and he ended up with with amputation for his both of his limbs.
I'm really sorry for that. Okay, just have you experienced any shortness of breathiness or heart problem?
No, doctor.
Okay, and have you experienced any difficulty in passing urine or difficulty in swallowing?
No,
Okay, do you want to ask any question?
Can you please
no.
summarize your history now?
Okay, today I have I take history from Mr. Andrew, who is 43 years old, who presented by bilateral lower limb claudication with a progressive course in nature. Started a long time, but accelerating through the previous 2 months. The pain increased by cold weather and increased by walking upstairs and relieved by rest. There is manifestation of peripheral vascular disease such as ulcers and coldness, neurological manifestation. There is no back trauma or any spinal pathology may cause this condition. So my main differential diagnosis will be chronic limb ischemia in the form of peripheral vascular disease, and to a less extent, spinal pathology may cause the symptoms or spinal trauma.
Okay,
Spine trauma.
good. How
Okay.
would you confirm your diagnosis? What investigations would you ask for?
Okay, I'd like to start assessing my patient by doing some full neurological and vascular examination. Also, I have to do cardiovascular examination. I have to arrange him for arterial duplex to show flow of the blood and any blockage of the flow of the blood. If I'm planning for surgical intervention, I have to do CT angiography or MRI angiography to see if there is distal runoff or the site of blockage or the distance of the blockage. And according to this investigation, I have to discuss the results with multidisciplinary team and optimize the patient for surgery by optimize his blood sugar, his blood pressure, and cholesterol. Give him anti-lipemic and anti-lipemic agents. And surgical option here will be endovascular stenting, amputation, and bypass, surgical bypass, according to the severity of the
Condition.
severity of the
Okay, good.
blockage.
How would you differentiate between vascular claudication and neurological claudication?
Actually, vascular claudication occur in the cuffs, thigh, and buttocks. It increases by walking up a hill or upstairs, and decrease relieved by rest. There are some manifestations such as skin ulcers. But spinal pathology or spinal claudication occur. There is a history of trauma in the back or back pain. Walking up a hill or upstairs relieves the pain.
Yes.
So
And there
okay.
are also the risk factors like this one, patient is smoker.
Yes, having a
Okay.
smoker and blood pressure, atherosclerosis, and hypercholesterolemia.
Yes.
And diabetes also may be a risk
Yeah.
factor.
That's that's also one of the difference. Good.
Yes,
Very
yes.
good. Excellent.
Okay.
And then the type of pain as well, with the neurological or the spinal claudication, patient often pain gets relieved by walking uphill, whereas in this one, vascular claudication, patient has to take rest before continuing uphill. So that's also one difference, the type of pain, or how or when the pain starts. Good.
Okay,
Very good. Okay, excellent. Thank you.
thank you.